I'd like to welcome you to this online event where we have a great array of speakers for you this morning. Our first panel will be introducing research findings. I think people have read research, and I was listening to some of the conversations beforehand. I think there's a lot of worry and concern about what could be coming forward over the next few years.
The lack of affordable, decent housing, one of the most basic of human needs, we know is contributing to mental health issues like stress, anxiety and depression. So our discussions with the TCPA really started out from a mutual understanding that whilst poor housing has an impact on health and well-being, good quality housing, which is integrated with good quality design through the prism of placemaking, can lead to better health outcomes and indeed improve the health of our communities.
And I think as a starting point, we have to really start with the opening question we began with, which is not about what healthy places look like, because that is really well established. It's been really well established for probably more than 100 years. The question really is, why aren't we building these places? We tried to put these tables together as a more effective way of comparing between nations and trying to tease out exactly what the consequences and causes of these barriers were. And from just the sheer amount of green shading to the right-hand side of the table for England, you can see how much more extreme local officers and councillors regard the barriers to healthy placemaking in England compared to Scotland and Wales. And we've now got 5 years of longitudinal data to draw on from our previous TCPA reports with APSE, which have touched on a range of topics, but maintained that focus on the housing crisis and changes to planning reform over time. And it's quite clear from this evidence which is building up through our own research and others, that the government's planning reforms have largely failed to achieve their own objectives, let alone objectives which us as TCPA or other organisations like APSE might argue for. Is that right in the centre of this, there's a old office block which has been converted through permitted development rights into homes. What I think is so powerful about this image is that it doesn't just focus on the impact of the fabric of buildings and people's quality of life, but the wider location that many of these buildings are located in. This is in the very centre of an industrial estate, which is about 15 minutes across to get to the nearest form of social infrastructure, whether that's local shops or a GP or other homes. Those long established principles of what constitutes healthy placemaking, of walkable neighbourhoods, greenery, these things we've known for the best part of 100 years, are just not present in this development. Underpinning all of this, I think we need a really quite fundamentally different approach to the way we regulate the built environment. It's evident from the last 10 years of planning reforms which don't achieve the government's own objectives. We can see PDR undermining localism as a self-stated objective from government. It undermines our climate change objectives because it's so hard to improve the standards of new homes delivered through that. We need to really change at a high level this regulatory system. The Healthy Homes Bill might be a centrally important part of that. I think that will set the tone for future changes. And I think it also allay a lot of concerns which have been raised in relation to the white paper by laying out in the law that the minimum standards all new homes are expected to reach.
So I'll kick it off with the conversation that I had with a councillor who was new to planning in a conversation last week, who said, well, if you take permitted development, which is a parallel part of the reform process, which, as Paul has said, bypasses local democracy and largely bypasses local government control, and you take the new reform measures where democracy certainly is ironed out of the planning process for reasons I can come back to, then actually local government risks at a crucial time for the way that we make place on health, that risks being a bystander in its own communities. And I think that that's my proposition, that the answer to this question is actually that local government and communities empowered in co-creation of the kind of homes and places we want to create is undoubtedly the answer to the question. In looking forward to where this report goes, I think we've got to massively rebuild the capacity of local government, massively rebuild the ambition of local communities to build better places, and to do that really quickly. I think the white paper is simply the wrong answer to the wrong question. We now urgently need an alternative.
And I think it's one of the things that local planning authorities can do is thump the table with developers. I think we just have to say to them, this is not good enough. And I've done it. I've had developers and, the big four sitting opposite me saying, and I just tell them, this is not good enough. Go away and rethink it. Come back with something that you will be proud of, that can be an exemplar, that you will want to show to other councillors, to other planning authorities, that actually this is what you can achieve. And we do this mostly through a master planning process, which is a policy, an adopted policy within our district plan, which says any site which is significant, not even strategic, but significant, has to go through master planning process.
We've gone to great lengths to ensure good design, little cul-de-sacs, shared spaces where kids can play and pedestrians can walk, safe parking areas, no long streets, no long rows of identical houses. And the best compliment that we get is that people say we didn't know they were council houses, or they don't look like council houses.
Newbury House, this is the one that got me started. The smallest single studio, one with the left-hand one with the red blob, is 13 square meters, and the smallest double studio with a double bed in there is 14.7. It's utterly ridiculous. Next one, please. And there's that Newbury House smallest studio with an NDDS compliant one-person flat alongside it at the same scale. So that's the space you should be getting, and on the left is what that person is getting. It is unfit for human habitation, and we have new worked examples in the housing health and rating system that prove that.
We simply cannot afford to ignore the links between housing and health. We also can't leave it to the market to determine what local place will look like moving forward. We need properly empowered, locally based, democratically accountable local government to act in the public's interests, acting as stewards of place and driving change for a better tomorrow.